Hi, my name is Tammy Yanovich. I am the Director of Medical Student Education at the Dean McGee Eye Institute. Today we will be discussing what to look for when you perform an ophthalmoscopic exam. The goal of this lecture is for you to be able to describe and identify a normal optic nerve in retina. You will also be able to describe and identify several pathological findings including papilledema, optic nerve atrophy, glaucoma, proliferative diabetic retinopathy, and hypertensive retinopathy. The photograph on the right shows a normal posterior segment. The view to the back of the eye is clear. The retina appears to have an orangish red color. The blood vessels do not show tortuosity or abnormal growth. You can see here the narrow blood vessels are the arteries and the thicker, darker colored vessels are the veins. And then this area right here is called the macula, which is the sweet spot of the eye that gives you good central vision. And this is the optic nerve, which carries the information from the eye to the brain. And there is a healthy rim of pink tissue, which you can see on our next slide. It gives some more magnification. In this enlarged photograph of the optic nerve, you can see the margins are distinct and there's a healthy pink outer rim of tissue. The optic nerve cup, which is the white divot in the center of the nerve, is about 1/3 of the total optic nerve area. Sometimes in eyes that are more nearsighted, the optic nerve may appear slightly smaller and tilted. However, it's important to note that the nerve does not appear pale or swollen. In papilledema, increased intracranial pressure causes bilateral optic nerve head swelling. There is venous engorgement with bilateral optic disc elevation. The nerve will have blurred margins. There can also be flame-shaped hemorrhages and cotton wool spots surrounding the nerve. Glaucoma is a condition where elevated eye pressure causes damage to the optic nerve. The optic nerve cup, which is the white divot in the center of the optic nerve head, appears enlarged. Here is an example of a normal optic nerve head with a pink, healthy outer rim. In this nerve, which has glaucomatous cupping, notice that the white divot is significantly increased compared to the amount of healthy rim tissue. In optic nerve atrophy, the optic nerve is damaged too, just like in glaucoma, but instead of increased cupping, the nerve appears diffusely white or pale. You can see here in this example, the nerve head is diffusely white and there is no healthy rim of tissue. In this example, there is pallor of both the nasal and temporal portions of the nerve and sparing of the superior and inferior pole, which can sometimes also be seen with optic nerve atrophy. With hypertensive retinopathy, the changes occur primarily in the retina. Early in the disease process, you can see AV nicking, which I have a better picture of that's more magnified on the next slide, and also copper wiring, which is shown here. And again, I have another picture that shows that more magnified, and I think it's easier to see. Later in the disease process, you can get hemorrhages, which can be dot blot if they occur in the outer or inner plexiform layer, and also flame-shaped hemorrhages, which are consistent with hemorrhaging in the nerve fiber layer, cotton wool spots, which are little ischemic areas in the nerve fiber layer, and finally hard exudates. With really severe hypertensive retinopathy, you can also get optic nerve head edema. Here's a more magnified view of what happens with AV nicking. You can see where the artery crosses the vein, there is tapering, and this is due to compression by the atherosclerotic artery that overlies the vein. Here's another example of copper wiring that occurs with hypertensive retinopathy. You can see the empty lumen of the arteriole gives it a metallic appearance. In proliferative diabetic retinopathy, there is formation of abnormal blood vessels. The vessels appear as a twisted collection of small blood vessels and can occur on the optic nerve or in the retina. This table provides a summary of the main findings you will see in each of the conditions that we have reviewed. In terms of optic nerve pathology, you may see papilledema, glaucoma, or optic nerve atrophy. With papilledema, the disc margins are blurred bilaterally. In glaucoma, there's increased optic nerve head cupping. And finally, in optic nerve atrophy, the nerve will appear diffusely white or pale. With hypertensive retinopathy and proliferative diabetic retinopathy, there will be changes in the retina. In hypertensive retinopathy, the arterioles and venules are abnormal. You will see AV nicking and copper wiring. In proliferative diabetic retinopathy, there is the abnormal growth of new blood vessels, which can appear either on the optic nerve or in the retina. Thank you so much for your time and attention. We look forward to working with you in the clinic on your ophthalmoscopy skills.